In this video, I've got some excerpts from a video podcast that I did with Dr. Anthony J. And look on screen there. I mean, shit, I mean, damn, I mean, come on. Look at the pattern he found with these estrogenic like chemicals. They're not just affecting you, they're affecting your mum and your dad. They're affecting your partner and your kids and your friends and every other living creature on the planet. So let's hit it. Let's roll into this now.
So I always tell people, get off the estrogens, because I've seen people double their testosterone in 6 weeks and just maintain it at, from 400 to 800, for example,
Yeah.
just by removing these artificial estrogen chemicals on that top 10 list. So that's a good start. But then, of course, if you're exposing yourself to heavy metals in some way, you got to get those out of your system. And a surprising number of people have high heavy metals, and then they're on testosterone therapy, but they never hit the heavy metal problem. So eventually that's going to catch up to them. Whereas the completely artificial man-made estrogens from the petroleum products like BPA, phthalates, parabens, oxybenzone in the sunscreens in America. Do you guys do oxybenzones over there?
I'm pretty sure we do, unfortunately. And I read in your book that it actually bakes onto the estrogen receptor.
Right.
Holy
Yeah, the ultraviolet. Right. Yeah. You want to really trigger your estrogen. Yeah.
And damn. But what does that mean, right? The estrogen receptor. What actually happens? Well, when your estrogen receptors are activated, they can fire up this enzyme called aromatase. And guess what happens? You've made your testosterone. Yes! Aromatase fires up because these fake little bastard estrogens are inside you and they shouldn't be there. And it turns it into estrogen, estradiol. What happens to a man? Man boobs. That happened to me in my 20s and 30s. Damn! We got to get these chemicals out, right? And I also read that that particular one is stored in your fat cells.
Oh yeah, all of them, a lot of them.
All of them. All right. So let me just create this scenario. So you've decided that you want to lose weight, and you've decided to do that. You start losing a bit of body fat, and all these estrogens are liberated into the fat cells. And I saw a research paper that you showed that some human fat cells have got, I think, 16,000, is that right, nanograms in the fat cells.
Oh,
so basically, you're flooding your blood with all this estrogen. What's going to happen then? Testosterone, free testosterone goes down. So your brain doesn't work properly. It's like, you lose your will to do the diet, and it makes muscle preservation harder. It makes fat loss harder. It makes everything harder. And you're fighting this, trying to lose weight, and you've got all these estrogens being flooded into the system. Is that a fair call?
Oh yeah, you got it exactly. I mean, I can tell you read the book carefully. I appreciate that, and that's a huge epiphany, even for me, when I was kind of going through this process and learning about this, writing the book. And
I've also heard another doctor talk about that you have to use a certain type of soap to get that off, there's another double whammy, I guess, because soaps are full of this shit, right?
Right. Well, that's the thing. Yeah. I mean, it doesn't really have to be a certain kind. It just has to be, it has to be a certain kind. Yeah.
Yeah, that's right. So if that's a double whammy. Like you're sweating it out, then you're putting it back on with the wrong type of soap.
Yep. And people think you're washing it. Yeah, but it sticks on it prefers to stay on your skin than to wash down the drain. So yeah.
Well, it makes sense because the soaps are full of fats as well. Those fats, like you get on testosterone replacement therapy, you use creams, you rub it onto your skin and it goes into you. So these soaps, they're doing exactly the same thing. They go penetrate your skin, and next thing you know, you've got all this estrogen floating around in your system. Right. And as that study that I'll put it up on screen there for the listeners as well. With that milk study, 1 hour, and it's just destructive, completely annihilating your free testosterone. So, and we're talking not just men here, but also women. It's extremely important for women. Is that right too?
Oh yeah.
What should women's levels be at? Like, I think men's, my age, I'm 49, so I guess mine should be around about 800 if I'm correct.
Yeah, that's, I mean, the most doctor, if you get below 500, I think it's a big problem. Better fix it, you know, like immediately.
Yeah,
I agree. If
yeah,
you're 800, that's awesome. If you're
yeah,
1,000, that's super
yeah,
awesome. It's hard to achieve, right?
yeah, yeah, yeah,
But,
yeah.
and I think, you know, if you look at the paleo records, and I mentioned this in my book, and that, you know, it does if you're really abysmal. And again, there's
Yeah,
always that, like, it's okay, so whatever. But
yeah.
these guys at that level, they're going for optimal. They're not messing around, you know?
No, no, we should be going for optimal too. Like I know with my doctor a few years back before I kind of upgraded to another doctor, all he was worried about was just ticking the boxes and getting it in normal ranges. And I
Right.
didn't feel good in normal ranges. Didn't work for me at all. So I
Yep.
had to work with someone else to get, high normal is where you want it. That's where you feel good. That's where the energy picks up. Damn, right. As you can see, Dr. Anthony J wrote a book about this, and it's called Estrogeneration. He found a pattern with these chemicals, right? And this is the pattern he found: fat gains, depression, hormonal disruption. That's right. You're missing out. You're missing out. Energy, immune dysfunction. This is the year of the COVID. I mean, seriously. Blood clotting, cancer, and infertility. So it's extremely serious, and this research is just starting to come out and turn heads. I mean, you got a lot of power. What you got to do is, step number one is to eliminate these estrogen-like endocrine disrupting chemicals, these little bastards. I mean, it's kind of funny. They're coming along and pushing on your estrogen receptors, giving us man birds for guys. But, right there on screen, Dr. Anthony called it the 7 deadly things. That's the pattern. This is serious. So, it's not just for yourself. You've got to think about your mum and your dad. You've also got to think about your partner, your kids, but everyone else on the planet. I mean, it's causing depression and people get angrier. Can you imagine? Think about it. Can you imagine if we all came back online, how amazing this world would be? So this is my goal in life, is to let people know that you can get your testosterone. You can double it in 8 weeks. Your feel-good hormones come back online. Your energy comes back online. So below the details about how you can fix this, where these little bastards are lurking, because they're everywhere. They're in fake grass. They put this stuff in your car. You see, one of these chemicals acts as a sunscreen, as we've just talked about, on plastics. And your car heats up, right? And it starts leaching this shit out. So you get into your hot car, you breathe it in, you're sucking in estrogen. It's not a good thing. But you can protect yourself. You just basically open your car doors up and turn the air conditioner on and blow that shit out. But there's 2 things you can do right now to get rid of these chemicals. There's a process in the body called glucuronation, and this extracts the chemicals out. However, it can be inhibited by pain meds and also anti-depression meds, anti-anxiety meds. So can you see the paradox there? Your body can get rid of these chemicals, but Big Pharma's winning because they're giving you these products that inhibit your body's ability to get rid of these chemicals and causing depression. I mean, come on. Not fair, is it? I mean, seriously, I was on anti-anxiety meds in my 30s. You don't have to live like that. You can come back online. It's not difficult. There's 3 steps in the Mark-I method. So if you want to get yourself back online, you want to feel good, you want to have energy, it's really simple to do. You just have to decide you're going to do it, because we've got, every moment we can make 3 decisions. Decision number one is to put things off. We're stress-based. Like, fuck it, I'm not doing it now. I'm sick and tired of this shit. Couldn't be bothered. I'm just going to go have my beer and my junk food and make it all worse. Or you can struggle through the day, do just enough to get by. That's what most people do. That's what I did, for Christ's sake, for 46 damn years. And I thought that I was winning because the gurus say you got to push, you got to fight, you got to struggle. Well, to hell with that. The last 28 months, I haven't been pushing, I haven't been fighting, and I sure as shit haven't been struggling. I've been winning. And you can too. And the third decision you can make is to take action now. Step up and do it, because you got this thing, this one life, and these chemicals are taking you out. Make no mistake. And when they're in your food too, right? They're in your food. And I call this Western slave food. So anyway, the Mark I method's got you covered. Details below. Hit it. Check it out and get yourself back online. I'm Mark Guyon, creator of the Mark Guyon method, and I'm here to get you winning at life.